We're the only Level III neonatal intensive care unit in the region. What that means is we actually can take care of babies that are born as young as 23 weeks up to term or post-term, but we actually have the specialized team that can care for the extreme premature and extremely sick babies that need additional support. The babies that would require neonatal intensive care are those babies that have a delay in transition. They have a known disease process, an anomaly, and especially if they're born prematurely. And they need to literally stay with us, sometimes weeks, months, to continue to grow and develop and provide the nutrition that they need. We actually have a protocol in place that when we are anticipating multiples, we increase our staffing grid. Each baby will have their own nurse. They will have their own provider, a nurse practitioner or neonatologist. We have a specialized team that is prepared to manage the multiple delivery, whether it's by C-section or otherwise. And we actually have that plan in place often weeks before. We know when they're coming, and we have that on-call staff ready to come in as soon as we know the multiples are coming, either unexpectedly or a scheduled cesarean section. Here at Mary Washington Hospital, we have in-house 24/7 neonatology coverage. Our neonatology care team is Children's National Hospital, the #1 ranked neonatology group in the country. In addition to our registered nurses, we have a full care team. We have dedicated respiratory therapists that work with our nurses in our NICU. We have physical therapists and occupational therapists who work with our babies who have difficulty feeding. We have case managers who work with the families to coordinate, make sure every family has what they need when they go home. There's ongoing teaching. We're going to teach you, we're going to help you understand why your baby's in the NICU. We are going to include you in the care of the baby. You're going to learn to take the temperature. Even if your baby is extremely premature, we're going to teach you how to care for your baby, because the best person to care for your baby is you. If in the event your baby needs a specialty service, let's say a cardiac anomaly is determined, it's determined that baby needs surgery or a specialist, our relationship with Children's National means that we have access to those specialists 24/7 without delay, and your baby will get the care that it needs as emergent as it needs to happen. Children's National transport team will come and pick up your baby and bring it to the Children's National Hospital in Washington, D.C. If your baby is born at one of our neighboring hospitals that does not have a Level III, we can actually send our transport team to go pick up that baby, your baby, and bring it to Mary Washington for the care and the services it needs that cannot be provided at the hospitals that do not have a Level III NICU. Having a Level III NICU here in your community is vitally important so that in the event that your baby needs that higher level of care, you can be close to your baby. If your baby is actually transferred out of the community, it's actually quite a hardship, just commuting, traveling, going to visit your baby. You'll lose that time for bonding, you'll lose that time with family support here in your community. We here at Mary Washington are a family in Fredericksburg, here to serve you and your baby.